Hello, it's Dr. Agnes Straukiene, your wicked MS neurologist from BeewellwithMS Podcast. Expect science, sparkles, and whole lot of sass. Let's dive in. Hello and welcome back to Be Well with MS Podcast, the podcast that brings very fresh conversations about brain health, lifestyle, living well with multiple sclerosis. I'm your host, Dr. Agnes Straukiene, neurologist. I'm a researcher, advocate, and inspiring people living with MS to take control of their health journey. Today, I'm excited to welcome my guest who brings both professional and a personal understanding to the topic of sustainable weight loss and management. Dr. Doriana, she's a family physician, founder of SmplyFit Wellness, and she also a host of the SmplyFit Podcast, and a coach who helps busy women find balance with a diet, fitness, and self-care without guilt, shame, or restricted diets. So in this episode, we will dive deep into what sustainable weight management actually looks like for women living with chronic conditions, whether it's MS or any other underlying neurological or other chronic condition. We'll explore why traditional dieting fails, how to work with your body instead of against it, and how to reclaim your competence. That's the most important, no matter your energy levels or schedule. I welcome you, Dr. Doriana, to this show, and maybe let's start with a brief introduction about your background, about you.
Yes, for sure. Great. Thank you so much for having me, first of all. So yes, I'm Dr. Doriana. I'm a family physician based in Toronto, Canada. I actually had a family practice for 15 years, and in 2021, 2022, I decided to switch career paths, and I closed my family practice and I started doing online coaching in this space, which basically what I do now is I coach predominantly women, but not just women, predominantly women who are very busy. They lost themselves. They're stuck in a rut. They've gone through years of yo-yo dieting. I teach them essentially how to lose weight in a way that is sustainable for them, that is not overly restrictive. And I really teach them how to make lifestyle habits and how to incorporate things like fitness and exercise and self-care into their days so that it becomes an automatic part of their daily life. Because through 15 years of practice, I had a lot of patients struggle with these kinds of issues. And so basically what I do now is I teach them how to do that in a way that feels comfortable for them and in a way that tailors to their particular schedules.
Wonderful. It's great to have you on the show. And I think the very sensitive topic that we chose to discuss today, it's not an easy one. Quite often in my clinics, I see patients, women who come in, they tried various different approaches and diets in the past, and they still have a great struggle. And it becomes a bit of a psychological issue getting to the goal that they dream about, having healthy weight, healthy appearances, because it really drains their energy. And I just want to maybe just start, why is sustainable weight management an important conversation for women? How do you approach women? Because you don't want to highlight that there is a problem with the weight, because every woman wants to be beautiful and nice and feel good, full of energy and produce good things in this life. And almost there is an elephant in the room when they come in that there is a problem. How do you approach women saying that there is a problem? How can we solve, and where this kind of sustainable weight management stands in this kind of conversation and why it's important?
Yeah, it's really interesting that you bring that up because even in the last few years, the whole conversation around obesity and obesity as a chronic disease has really changed, starting with how do we approach it with patients. And so in the certifications that I've done through Obesity Canada and some health coaching certifications that I've received recently, one of the key elements here is that we don't assume with any patient that their weight is something they want to discuss. And it is a very sensitive topic. And so when we, as physicians or as coaches, when we want to approach the topic, we need to ask permission. We need to ask the patient permission. Is it okay, or do you want to discuss your weight today? Because if that patient is not ready to discuss it, if they're in that sort of pre-contemplative stage of change, telling them what they should do or trying to scare them into losing weight just doesn't work. It just doesn't work. So we have to approach weight loss and weight maintenance with empathy and compassion. And we really have to understand where the patient is in their journey. And that's been one of the big takeaways that I've come out with in the last few years. Because when I was training, and even when I was practicing medicine for the first maybe 10 years, our approach to speaking to patients about their weight was very different, right? They came in for a physical, we did their height and their weight, we calculated their BMI. They were either underweight, normal weight, obese. And we just gave them that data and said, well, your BMI shows that you're obese, so you need to lose weight. That is the complete opposite of how we approach it. And nowadays, it's a very different approach.
Yeah.
So I think for me, that's one of the biggest changes in exactly how you said, how do we address that elephant in the room? So, when a patient comes into the office, do you want to discuss your weight today? And if they say, no, I'm not ready to, it's not why I'm here, then that's fine. As physicians, they know that we're there to help them, but we also have to work at their pace and go along with them along that journey. And then as far as weight maintenance goes, it is really, I think that we have lived through years of diet culture, and so many of my clients have lived through years of diet culture. I myself have experienced years of diet culture growing up in the 80s and the 90s, and weight maintenance is the key term here because most people can lose weight. It's not the weight loss that's the problem. How they're going about that can be problematic, but how do you maintain that weight? And the next question is, what is your best weight? What weight should you be striving for? Because again, we've really stepped away from using the BMI or the body mass index as the sole indicator or the sole measure of health. We use other measures as well. So it's not as cut and dry as it used to be. There's a conversation to have that has many elements. It's very complex and it's very individualized according to that patient and their lifestyle, their schedule, their other medical conditions, all those other features, their genetics. So we have to take all of that into account when we're talking about their weight, weight loss, weight maintenance.
Wonderful. And I think you beautifully described that, first of all, you assess the readiness for that conversation without jumping into and advising people what they need to do. They've listened to these kind of advices millions of times. They know what they need to do. They know their problem. You don't need to highlight, but I guess gently ask the question whether they are ready to talk about and discuss it, and working at the pace of that woman that sits in front of you. So a lot of people with MS or any other chronic condition, they suffer from fatigue, mobility problems, some side effects from medicine that they take. Usually it's a polypharmacy, amitriptyline, baclofen, gabapentin, pregabalin, various different neuropathic and central nervous system affecting drugs that causes a lot of extra layers and more issues with being alert. Usually it's lack of energy, more sedentary lifestyle. So symptoms like that, how do they affect the weight and metabolism? And maybe let's delve on this kind of aspect, chronicity, underlying conditions that don't allow people to focus on or maintain their healthy weight.
Yeah, and I think this is a booming part of obesity medicine right now. It's the understanding of what obesity is or how weight loss occurs amongst different populations. And at the end of the day, weight loss is a very simple physiologic process. We have to be consuming fewer calories than we're burning in order to lose the weight. So we say weight loss is very simple. It's just a mathematical equation. We just have to get you to burn more calories than you eat. Now, the reason it becomes very complicated is because there's a lot of things that can affect how many calories you're burning and how many calories you're ingesting. So for example, fatigue, feeling tired all the time because of maybe some medication side effects. Those will cause you to feel less likely to get that daily exercise in, even if we're not talking about specific like gym exercises you would do in the gym, but even just your NEAT activity, that non-exercise activity thermogenesis, like just the walking, the steps, pacing around during the day. If you're fatigued, you're much less likely to do that kind of activity. And so that can contribute to you not burning as many calories. So that's a big one. Obviously, if you're dealing with MS, there's other issues in terms of mobility and muscle strength and that kind of thing. So again, it's always trying to find that balance between how many calories we're ingesting versus how many calories we're burning. But at the end of the day, the principles stay the same. If your appetite is increased because of medications, because there's certain medications and other chronic conditions that cause appetite increase. Sometimes in those patients, they have to be on those medications. That's not an option to manage that condition. So how do we then help them to lose the weight? Again, then we have to talk about, okay, let's talk about hunger cues, listening to those hunger cues. There's lots of tips and tricks about eating food without eating too many calories. So I think it just highlights this concept that weight loss from a mathematical perspective is actually very simple, but it's not easy because you have so many other contributing factors that can affect things like your energy output, your exercise output, your hunger, the drive to eat, the emotional stress, or maybe that the mental health stress that comes with having a chronic condition, and sometimes using food for comfort for that. So it is a very psychological process as well as a physiological process when you're talking about weight loss and maintaining that weight loss.
Yeah, absolutely. And I guess when we live more sedentary lifestyle, where we move less, our metabolism is slower. So the digestive system is slower, so it's more accumulation of the fats, in subcutaneous fats, and also visceral fats, which is even more harming to the outcome if you have organs surrounded with the fat. So it's more harmful than just having subcutaneous extra layers and fats.
Yes.
Yeah, so I guess the research behind the scenes suggests that, as you mentioned, the psychological factors plays a critical role in sustainable weight loss.
I think it's important to highlight something else, is that there is this misconception, and I know I work a lot with perimenopausal women and menopausal women, and there's this misconception that as we get older, our metabolism declines. But in fact, our metabolism does not significantly decline until we're probably in our 60s. And even then, it's not a significant decline. So for years, I think we've been using this, oh, my metabolism is slower because I'm aging, so that's why I can't lose weight, and it's just impossible. What we know is that our metabolism, that basal metabolic rate, is largely genetically determined, and there's not a whole lot we can do about that. However, there are other ways that we can slightly change that metabolism, which is good to know for people, because if people are struggling with chronic conditions or they are on medications that are making weight loss more difficult, it's helpful for them to know, how can I increase my metabolism a little bit so that I can get the best bang for my buck. So things like eating more protein. So if you're not meeting protein requirements, a simple thing we can do is to eat more protein. Why? Because the thermogenic effect of food is the actual burning of calories as we're eating. And we actually burn more calories eating protein than we do other macronutrients. So simply by making a small change to your diet, like adding some protein, can help to increase that metabolism slightly. The other thing we can do is lift weights or do weight training, because having more muscle means we increase that metabolism a little bit. So that's another key thing that we can do, even in patients who are struggling with other aspects of weight gain. Things like that NEAT activity that we talked about, the pacing, the walking, the step counts. Being aware of those things and being aware of that activity and conscientiously trying to increase it can help increase your metabolism a little bit. So if we can increase that metabolism a little bit and simultaneously adjust the calorie intake, then we've got the solution for weight loss and how to maintain it. But I think it's critical for people to know that, because to me, knowledge is power. And when people are walking around thinking that their metabolism is just broken and there's nothing they can do about it, it takes power away from them. And then they think there's nothing they can do. But if they have this information, it's, oh, hold on a minute, there is something I can do. I'm not destined to gain weight just because I'm aging or just because I'm perimenopausal or just because I have a chronic condition. there are things that we can do to help these sort of the contributors to our metabolism and our weight.
That's very interesting. So also, according to the literature, every single human on this earth gains 1 or 2 kilograms a year. And that pauses from age 55 onwards. So whatever we do before age 55 has got a huge influence on our metabolic health and our just general sort of health and weight, if that makes sense. And you're completely right in terms of the rich protein diet would help us to less accumulate fats, because if we are consuming carbohydrates that in our bodies being converted into the glucose sugar, and that this arranges the metabolism of the fat, so you have layers and layers of fats inside the body. So it's a critical thing. And I think as we started with the psychology factors that helps us sustain the weight loss, equally having a goal set and realistic expectations are crucial for the weight maintenance among women. The research categorizes women into maintainers, regainers, and stable health weight individuals, emphasizing that unique psychological struggles faced by each group. Another study reveals that motivation-based focused strategies can be as effective as traditional skill-based approaches in maintaining weight loss, suggesting the need for programs that cultivates internal motivation rather than teaching skills. So it feels we need a goal, we need some purpose and motivation behind all these kind of strategies. Would you agree, and what would be your sort of experience? How do you work with your clients in setting the goals and motivation?
And from here, I would like to pause. No, this is not an advert. I'm not selling anything. It's just to let you know that I lost my video during this interview. And we didn't even notice because our conversation was so flowy, natural. We were just chatting around. Doriana felt like this is what I've done for purpose, without coming and saying, "Oh, you lost your video." So she thought this is what I meant to do anyway. So she just being polite and me not noticing what's going on the screen, getting into the conversation, thinking about what the questions to ask, how to finalize our key points, how to summarize the discussion. You know, these things happen. So so enjoy the rest of the conversation. You will see my picture instead of video, but if you are listening this, it's fine. But if you're watching on the YouTube, probably you're going to lose my gesticulation and moving arms because I love to do that very often. I'm not Italian, but I somehow got this in me and I use my body to express myself. So never mind, next time on the YouTube channel, you'll see me moving. I'll be more mindful of noticing if my video disappears. It was just a fault on the Zoom call at the time. But never mind, I used some visuals to fill in some gaps. So enjoy the rest of the conversation. So just to remind you, I asked Doriana how to set the goals and bring the motivation to lose the weight.
Yeah, I think this is like my passion. This is what I do. This is what I love to do. And this is my favorite part of the program, because when I work with clients, we work on 3 things. We work on their nutrition and their diet. We work on their fitness, and we work on, I call it self-care. But what that self-care component is really based on is the psychology of eating. And so there is a huge weight loss that I think gets ignored by a lot of diets and programs. And that is, first of all, I want to teach you how you're getting into this calorie deficit. I want to teach you those basic skills so that you're not relying on me to just tell you what to do. And then when we stop working together, you have no idea why you did it. So that's number 1. But the second part is the psychology of eating is very complex. And if we're not addressing that, then we're missing a whole piece, and we're probably missing the long-term success. So when it comes to changing behaviors around eating, I want to know, and I talk to my clients about, what is your relationship with food like? Are you using food for comfort? Maybe that's what you were taught growing up. Every time you had a bad day, or if you experienced some sort of trauma, you were given food for comfort. We talk a lot about identity shifts, right? So we know that in somebody who is making a big change. Okay, so they're trying to lose weight. This is something they've dealt with for many years. We need that person to actually believe and make an identity shift from somebody who can't lose weight, who's struggled to lose weight. I can't do this. I've failed so many times, to I am now a person who lives a healthy lifestyle. I make good choices. And we need to, what I do with my clients is I really tell them and teach them how to focus on becoming that identity. Because we know that people who accept that identity, even if you don't believe it at first, but if you can keep telling yourself, this is who you are, then the decisions that you make are going to be based on that new identity. That's a really important piece as well. The other thing I always think of that's really important, and my clients and I talk about it a lot, is what is your why? What is your why? And when we say that, I'm not talking about, part of it might be I want to wear that dress in the summer that used to fit me, and I have a wedding coming up and I want to be able to wear a certain outfit. But your why are things like, you know what, my father passed away at an early age from cardiovascular disease, and I don't want that to repeat itself. So for me, the why for that particular client, it could be, I want to live longer and I want a good quality of life and I want to avoid cardiovascular disease. For some people, it might be, I want to be able to pick up my grandkids without having to huffing and puffing and being short of breath. I want to be able to travel, maybe for some people, right? I want to be able to retire, travel, and walk in countries and explore. And at this weight, I can't do it. So if you really dig deep into people's purpose, their why, their identity shifts, it gives those goals far more importance, as opposed to just saying, I need to lose weight because my doctor told me, or I need to lose weight because I want to wear this bathing suit in August. We really have to focus on and think about why and what change this is actually going to make in that person's quality of life.
With this weight management, once you start seeing the results, I think it brings a lot of happiness. But we really need to not forget about the 85-year Harvard study, which suggests that number one thing that makes us happy in life is not your weight, is not your appearance, is not what you're planning to do. But one simple thing is our happy relationship. And it's a big study. What do we do with ourselves? Who are we surrounded by? Who are the people? What are you pouring on your plate? Is it plenty of respect that comes from your environment and people that you are being supported? Do you have a big chunk of the attention? What is right for you? And the sprinkle of the kindness. I think these kind of things are super important to live a really happy life. And I think we may overdo and focus too much on and set these kind of agendas in our lives and never reach that agenda. It is another a caveat that it's really difficult and challenging, although you have all these intentions and maybe motivation, but it's still quite difficult to achieve. So what is the non-restrictive approach to eating? Can you explain what that looks like in practice? What simple things that people could do to help themselves?
Yeah, I'll definitely explain that. And I also think I love the fact that you brought up this, what actually makes you happy at the end of your life. And I think one of the relationships that's included in that is your relationship with yourself. A lot of the work that we do is, how do you talk to yourself? How do you view yourself when you're eating? Maybe when you've eaten food that is not aligned with your goals. Is that okay? Do you give yourself grace? Do you love who you are? And then what is your goal? Is your goal to just hit a certain number on a scale? That is not your best weight. Your best weight is not determined by a simple number. Your best weight is the weight where you feel good inside and out. You feel good physically, you feel good mentally, you're confident, you have good self-esteem, you don't have medical conditions, but it's not necessarily the weight that you were when you were 25 years old. And so that just touches upon, because you had mentioned being realistic with these weight goals and these, your ultimate end goals. And I think that's really important for people to understand. So in terms of sustainability and overly restrictive, the number one reason why diets fail is because they are overly restrictive, and they are behaviors that you cannot sustain the rest of your life. And we know that now. There's so much research to show that things like a plant-based diet, the Mediterranean diet, these are diets that are probably the healthiest diets that we can follow in terms of our longevity and our risk factors for disease. And they're certainly not low carbs. Like, they're not restricting any particular food. It's just about the quality, the type of food you're eating. And so I feel like a lot of people who have struggled with weight and yo-yo dieting have been told this narrative that if you want to lose weight, you have to cut out this food group. Carbs have always had a bad rap. If we look at the calorie content on a gram per gram basis between carbs, fats, and proteins, fats have the highest number of calories per gram, not carbohydrates. So why are we eliminating carbohydrates? It's just these misconstrued narratives that have been spun around and circulated. So what I teach people is when we restrict something, that persists. And so we don't want to be over restrictive. We want to learn how to eat foods that we love and we enjoy in moderation. And moderation is moderation. So how do we know how much food we're supposed to eat? How do we know when too much is too much? So it takes some work, right? It means that we usually track and weigh food for a while, but that's a learning tool that we use as well, because I don't want you to take anything out of your diet. I want you to learn how to incorporate it into your diet, because the minute you can do that and reach your goals, then you can do that forever.
You said that very nicely, that you have to feel good inside and outside. Reestablish your relationship with yourself first, and then the rest, including food. I think the great failure I see in my practice that it's a very wrong relationship with the food to start with. So people are consuming a lot of processed, ultra-processed food before they consume their very rich, nutritious meals. So there's different behaviors in drinking loads of sugar drinks, energy drinks, etc. So how important is intuitive eating versus structured meal planning for women with chronic condition?
It's interesting. I think intuitive eating is this thought or this practice where you eat when your body tells you to eat. You eat how much feels good to you. In my experience, this is just anecdotal, I think that intuitive eating can be a reason that people go in circles because they think they're doing the right thing. They think they're eating the right way. And in fact, when I have clients track their food intake for a week, usually, I would say 9 times out of 10, my clients are eating way too little protein, way too little fiber. And the other thing, because you mentioned what's the difference between intuitive eating or having well-balanced meals, so many women, they go through the day without really having structured meals. And so they come home and they think, gosh, I haven't eaten all day, I'm starving. And then they over consume calories in the evenings. Now, psychologically, they think, I haven't eaten anything today. I really haven't eaten very much because they haven't eaten during the day. And then they're making up for that and ending up in a calorie surplus in the evening. So if that's an issue, then having those structured meals can be very beneficial because it means that you're actually consuming good quality, nutritious food. You're hitting some protein and some fiber targets during the day, which then avoids that really strong hunger late in the day, or those cravings, or that psychological feeling that you've been deprived all day and now you just want to eat everything. With chronic conditions, I think it's just also beneficial it's just that sort of that feeling of satiety, and everything is just a little bit more level, right? You're avoiding those really significant peaks and valleys of hunger and then blood sugar dropping and feeling irritable. And it's so much more sustainable to have a meal structure plan where you are fueling your body throughout the day as opposed to just doing what you think works. Does that make sense?
Yeah, totally. And I guess we're coming to the conclusion that, again, it's very personalized. Some people who's got a very enhanced awareness of their body needs, who are super mindful, who's got plenty of time in this world, they probably can go with intuition and watch their portions, watch the time of the day they need to eat or their body needs to eat. But if you look at the general population, including ourselves, we are busy with our families, with our lives, work, etc., patients, clients, whatever. we do have lack of awareness of our body needs, and we quite often forget to eat in a timely manner. So structure is an amazing rescue for most of the people. If you haven't got that awareness, we have these kind of wearable devices, Oring watches that sort of sends us a reminder, and we probably need to utilize these kind of devices to let us know whether to move, to exercise, to do little steps, because we spend a huge amount of time sitting. That's a rescue, a plan for us. And again, some people may find this annoying and they don't want to have any more notifications and reminders when to move and eat. But I guess it needs to work for you as an individual. On the other hand, talking about what sort of nutrients people should consume more, I guess we're going to talk about this in more detail to support better energy for patients with a lung condition. But I just want to highlight before we go into that it's impossible to eat too much fat, because we can do that with the carbs and all the cookies and snacks and all the ultra processed foods, but it's difficult to eat only fats, and we're never going to overconsume fats. And by the way, fats are essential for our brain function. We need fats. We need a good fats just for the brain to function. So maybe let's dive into sort of what are these specific nutrients or dietary habits that support better energy level and symptoms living with the chronic conditions such as MS.
Yeah, and I think that it's not just fats that are hard to overconsume. It's actually whole foods. It's been shown that people have difficulty overeating and overconsuming calories when they're eating whole foods. Because think about it. Think about eating a whole bowl of broccoli, right? It's very hard to eat a full bowl, and you actually feel unwell after a certain point. But think of a whole bag of chips. Those are very easy to consume. And that's where this 80-20% rule comes in. So I'm a big proponent of everything in moderation, because that's what keeps it sustainable. If I tell you can't eat any chips or any chocolate or any ice cream, you're most likely to get to a point where you restrict and then all of a sudden you binge. But the thing is, we need to be aware of how much we're actually eating, because we might think we're eating only 20% of those ultra processed foods when really maybe we're eating 40%. And that's where tracking comes in. So just like you mentioned, the Oura Ring and these kinds of devices, in my practice with my clients, it's tracking. It's a food tracker. And yes, it's tedious. And I tell my clients from the outset, it is tedious behavior to have to track and weigh your food. However, think of it like you're learning a new language. It takes time, it takes work, it takes study for a little while, and then it becomes second nature. So after a month of tracking, you're going to know what 3 ounces of chicken breast looks like, or you're going to know what a cup of pasta, how many calories that has, how much protein it has. So the tracking and the awareness becomes very important there. In terms of nutrients, I think that we get very overwhelmed, especially in social media, right? If you're on Instagram or TikTok or any of these apps, you can be completely overwhelmed with supplements and vitamins and what supplements am I supposed to take? And by the end of the day, you'd have a list as long as your arm. We need to focus on basic things, because most people who are getting lost in the weeds of all of this stuff, they're not doing the basic things. So we need to focus on protein. Are we getting enough protein? And for the general female population, we're looking at roughly 0.7 to 1 gram of protein per pound of your ideal body weight. So there's a range there. But protein is number one, because we need protein. We need protein to build muscle. We need protein to feel full. We need protein to, again, help with our metabolism. The second one, so there's 3 macronutrients. We talk about carbohydrates, fats, and protein. But there's one nutrient that I call the fourth macronutrient, even though it's not technically, and that's fiber. Because most North Americans are vastly under eating fiber, and fiber is so important, right? Fiber protects our bowels. It prevents colon cancer. It can reduce cholesterol. And most people in North America are not hitting their fiber targets. So when we talk about fiber for women, we need to be aiming between 25 grams and 35 grams of fiber per day. So those are the macronutrients that we need. So those are the nutrients our body needs in the biggest amount to survive. Generally speaking, if you're on a weight loss journey, if you can figure out what that calorie deficit is for you in order to lose weight or even to maintain weight, And in that calorie range, if you can hit your protein and your fiber targets, generally speaking, your carbohydrates and your fats will balance out fairly nicely. So I think people become so obsessed with counting that they have this attitude of, I'm going to start a diet on Monday, so now I have to count every single thing, and they're tracking their carbs and their fats and their protein. And we have to remember to keep things simple, because simple is doable, right? Focus on your calories. Calories are king when it comes to weight loss. Focus on your protein, focus on your fiber. If you do those three things, then chances are you're going to be very successful.
Yes, totally. And we tend to eat on our emotions. So
very much.
Stress management, I think, and as we said, you won't overeat protein, fats, these kind of good nutritious things. It's impossible to do that. But it's very easy to overeat on processed and ultra-processed food. And also bear in mind that if you are combining your physical activity at some level of exercises 2 to 3 times a week, that requires extra protein, because the least you want is with exercises, you are obviously focused on your fat in your body as well as your muscle. And if you are underdoing your protein in your body, so you're burning not only the fat, but also a muscle, which you really need. You really need that muscle. So can we emphasize on that a little bit? People who are not careful, that they become slimmer, but slimmer from the perspective of losing the muscle volume.
And it's funny you bring this up, because I'm trying to get into the habit of not using the term weight loss, but instead using fat loss. Because weight is just the number on the scale, but our weight can be affected by many things, right? It can be affected by if we're retaining water, how much salt we had, if women are going to have their cycle. What we want is fat loss when we're talking about losing fat tissue, especially in people who are struggling with obesity. So we want to preserve muscle, we want to lose fat. And it's interesting because you work with a population who maybe, in some cases, are going to be maybe limited in terms of physical activity as they see it. But I think that there's something to really comprehend here. And that's the fact that, once again, the messaging that we're getting very often is you have to be in the gym for an hour at a time or it doesn't count. You have to be lifting weights 5 days a week or it's pointless. We know that we don't need to be doing that kind of work to make it effective. If you can lift weights 4 days a week, fabulous, but you don't have to. So again, it's about starting where you are now and then working up to the minimum. The American Heart Association recommends 150 minutes of exercise a week. That's usually, they're referring to like moderate aerobic activity. But the other piece that we need to remember is our strength training, especially in women, especially postmenopausally. Yeah. And I think even more importantly, if you do have a chronic condition such as MS, because we need to make sure that your muscles are as strong as possible, your balance is good, your mobility is intact. So even doing things like Pilates, some strength training, whatever that looks like, working on balance, working on proprioception, these are going to be activities and exercises that are going to contribute positively to how you manage your chronic disease. And I think that's really important when you look long term.
And don't forget to consume a lot of protein, in particular if you do exercise, and it's improving your It's improving your neuroplasticity, it's improving your function, it is modifying your disease trajectory, living with chronic condition such as MS or any other neurological or other, let's say, musculoskeletal, rheumatoid arthritis. Everything that you do in this life do matter. And in particular, if you're a woman, we are different from men. Biologically, metabolically, we have estrogen, which drops as we go through the phases in our lives, and it changes our body shape, it changes collagen, it changes how we look. It does cause a bit of a weight gain when we go through these phases, but we're really bringing that mindfulness approach and understanding of our bodies actually helps us to navigate through. If we are, each woman in this world, including Doriana and myself, if we were not too careful, we would be obese. We would be really overweight, and that applies to any woman. But it's just, what do you do? What relationship do you form around you, outside, inside? And then what do you do to help yourself to have that sort of nourishing, good quality of food? And lots of questions around what diet, specific diet in MS, for example, are available. What evidence do we have? There are loads of diets around, and you name it. But I guess you have to find this individual diet that suits you. And let's bring this elephant in the room and talk about these kind of very trendy approaches these days. There's loads of questions, and I'm sure, Doriana, you do too, about the GLP-1 and the GIP receptor agonist. That is an easier way to suppress the appetite, slow gastric emptying, and improve insulin sensitivity. What are the cons and pros? And I've got a table prepared, to be honest, to contrast other ways of managing weight. For example, intermittent fasting versus the Mounjaro. But I would like to listen to your opinion on that, and I will then tell mine, if that's okay. Let's talk about this.
Yeah, absolutely.
Hot topic at the moment.
It is. It's a hot topic. So I feel like the world of obesity medicine is changing for the better. And I'm one of the people who really believes that these GLP-1 medications are life-changing for some people. I do also think that there's going to be many iterations of them. They're going to improve as time goes on because they are fairly new medications. Do we have long-term data? We don't have tens of years of data, but the data that we do have looks promising. So I think there's a few things to remember. The first one is that in order to be given a GLP-1, you must meet criteria, right? These are not medications that are supposed to be handed out to people who want to lose the last 10 to 15 pounds for vanity weight loss. That is not what we're talking about. These medications are specifically supposed to be used in people who have obesity. And obesity, the definition of that has now changed. It is carrying excess adipose tissue that is causing medical problems. Okay, so you have medical conditions as a result of the excess adipose tissue. These are the people who are supposed to be considered for GLP-1.
And for the audience, can I interrupt you slightly? Ozempic or Mounjaro drugs we're talking about. So these are classed as GLP-1. So just for the audience that they know what we're talking about. Yes.
Yeah, exactly. Yeah. The second thing I think that everybody is talking about is once you start these medications, do you need to take them forever? And the answer to that is likely yes. And that receives a bad rap. However, we have to also think about it in terms of we now know that obesity is a chronic disease. Obesity is not something like a wart on your skin that you treat and it goes away. Obesity is chronic. It waxes and it wanes. So if we think of things like hypertension, diabetes, those are chronic diseases oftentimes that we need to treat long term. So obesity is no different in that respect. So the answer to the question, do I need to be on a GLP-1 forever? The answer is likely yes. However, I think this is the backside of this story and this question is, so I get my GLP-1 medication, I lose weight and off I go. And I think that is absolutely not the way these medications are meant to be used. So yes, you may have to be on it long term. Whether you are or not, to me, doesn't change the fact that if you are on a GLP-1 medication for weight loss, you still must be addressing the lifestyle changes, the habits, the strength training, the therapy in terms of addressing the psychological aspects of eating. Because at some point, if you do decide to come off those medications and you have not addressed those issues, then of course we know you're going to gain the weight back, right? It's like saying to somebody who has hypertension because they're eating too much salt, take the medication, that'll control it. But once you take the medication off, just go back to your regular diet. Of course, that's not going to work. So in an ideal world, these medications would be prescribed with a personal trainer and a therapist to discuss the emotional and the psychological aspects of eating. Of course, that's not how they're always prescribed, but it's super, super important to understand that these medications are for a specific population. And when they are prescribed, they should be taken in a way that is an adjunct to all the lifestyle changes and behaviors that should also be taking place.
Absolutely. And I just going to strike the importance that consume protein if you are on GLP-1, okay? Because you're heading into that risk of losing fat very rapidly, very effectively, at the same time losing muscle volume. Because you eat less, as simple as that. You have less hunger, you eat smaller proportions, the average caloric intake drops naturally without needing conscious restriction being on this drug. Some reports suggest that people only eat once a day, and it's a no, unintentionally. It is just so natural. But if you are eating once a day, make sure that your protein level is 1 gram, as you said, 1 gram per kilogram of your healthy weight. So that's the consumption if you're doing so. Why is that? You really don't want to exhaust your body and become slimmer, but in the compensation of losing your muscle that you require the most. And in particular, living with a chronic condition like MS.
Yes.
But be careful from this perspective.
Absolutely. Absolutely.
And another
thing too is, oh, sorry, go ahead.
No, I'm just going to compare a little bit what is if you are, let's say you are aiming to lose 10 kilograms. So the calculation suggests that 1 kilogram fat, you need a 7,700 kilocalorie deficit. So if you want to lose 10 kilogram in the compensation of in the matter of the fat, so you need a 77,000 kilocalorie deficit. And it's over 6 months, the calculation suggests of 1,283 kilocalories per week, 183 kilocalories per day. So with the Mounjaro or Ozempic, a typical daily calorie deficit is around from 300 to 600 kilocalories per day. With intermittent fasting, which is a very cheap way of managing your weight, skipping meals, for example, breakfast, leads to reduced intake of your food, but that leads also to decrease your kilocalories a day from 200 to 500 kilocalories a day. It's a very similar approach of managing your weight with intermittent fasting. It's much, much cheaper. But again, it's very individual, isn't it?
It is. And I think that there's also a big misconception when it comes to intermittent fasting, which is maybe interesting to your audience. Intermittent fasting, out of all of the sort of fad diets that we hear about, I think intermittent fasting is one that could work for some people. And the reason is because there isn't anything that's magically happening during the hours you're fasting, right? We all fast at some point in the day because we sleep. But the fasting itself is not necessarily what's causing the weight loss. It's the fact that it's time-restricted eating. So if you're only eating between a certain time, between two times in your day, you are more likely to eat less calories. So you're inadvertently putting yourself into a calorie deficit. Now, that being said, if I said I'm intermittent fasting, my eating window is between 12 and 6, but I consume 300 calories in excess of my maintenance calories every day, I could very easily gain weight, even though technically I'm fasting. I'm not eating outside of the times between 12 and 6. So I think if intermittent fasting is a method that people choose, it's absolutely fine. It works for some people. It gives them that kind of hard line in the sand when they can eat, when they can't eat. But it's really because you are getting into that calorie deficit. So this is the other thing is if you're not spacing those meals out among your whole day, because now you're intermittent fasting, we need to make sure that you're getting the protein and fiber requirements in your time-restricted eating window.
Absolutely. And maybe just to list a few side effects from GLP-1 agonists. So are you aware of any side effects? So people should be concerned if they are self-medicating, which is possible in our country, in England. What are the side effects from taking?
Yeah, the most common ones that you're going to hear about are nausea. That's a very common one. And for that reason, you really should be given this medication under the supervision of a physician because you can adjust the dosing. You can start low, go slow. There was and have been cases of earlier on, they were talking more about risk of pancreatitis, some concerns around thyroid cancer. I think for the most part, those have been shown to be quite rare. The thyroid cancer issue, obviously, if you have any history of thyroid cancer, to avoid, and then issues of gastroparesis. The gastroparesis, which is basically like a slowing down of your stomach, that's one of the ways that GLP-1s work. The best advice is your body the best. So be aware of the symptoms, be aware of the potential side effects. And when things feel like they're significant and it's not normal side effects, obviously to seek medical attention. But those are probably the most common ones. Another one that kind of has less to do with the physical part, and I've had a couple of clients tell me this, is that it took away the joy of eating. if that makes sense. Because we forget that eating is part of our social culture. It's something we love to do. And so for some, and I've had a couple clients say to me that the GLP-1s worked great. They lost weight. It did reduce hunger, but it reduced that sort of joy that they got out of eating. And they didn't like that. So that's another potential side effect that I've heard of.
Yeah. Yeah, it's a low percentage of the pancreatitis.
Yeah.
Thyroid gland. So we're talking about 1 to 2% as a side effect from taking Mounjaro or Ozempic. So it's just being aware of that. If you start feeling symptoms of indigestions, constipation, maybe vomiting, you really need to seek some advice and ASAP. Okay, so you may require some investigations for that.
I was just going to say, obviously, I didn't mention blood sugar, but obviously monitoring your blood sugar and being aware of symptoms or signs of hypoglycemia.
Yes, yeah. When intermittent fasting side effects, hunger, irritability, headaches, migraines, fatigue, some menstrual irregularities if you are extending that period of time, more than 14 hours of not having any food, that could change your menstrual cycle. These are very rare, but it's possible. And if you are planning to become pregnant, trying to conceive, probably choose another way of losing your weight, or try not to exceed more than 14 hours of fasting, or maybe use some fasting mimicking diets, only 5 days every 6 months or so. There are so many different ways of managing your weight, believe me or not. Also, intermittent fasting could change your sleeping pattern. So you may have a bit of insomnia. So again, any intervention, it's not an easy one. It's always, you have to be watchful for any potential side effects, but some supervision, having some medical input. I think doctors who are prescribing medicine are automatically responsible for everything. Having a close contact and getting in touch with your own doctor who's prescriber of the GLP-1, I think is very important. If you can, try not to do that on your own. And in particular, if you have underlying comorbidities, underlying diseases such as diabetes in particular, because of this drug has been used in diabetes management. Or if you don't have a diabetes, your sugar may drop because this is originally being used in diabetes patients and discovered as a potential weight management drug. Okay, let's move into, unless you have anything to add, Doriana, anything?
The only thing I wanted to add, because I feel like there's a world of obesity that people who either they don't know that this is part of the obesity symptomatology, or they're not obese and so they've never struggled with this. But just one last thing about GLP-1s and what they actually do to help people is, I don't know how much you talk to your patients about food noise, and food noise being a very common symptom among people struggling with obesity. And that is this constant conversation happening in their head about food, where their next meal is going to come from. What am I eating? Is this healthy? Is this bad? How much should I eat? I shouldn't be eating this. So in somebody with obesity, the majority of their day, they've got this kind of conversation happening in their head. And it is so significant that it can impair their functioning. The GLP-1s help with food noise. And that's, again, another one of the ways that they work so well. And when you speak to people who are on these medications, it's like they have entered a new world. Like they don't know, they've never known what it's been like to live in such a quiet mental space where it's not constantly thinking about food. So I just wanted to mention that as another way that the GLP-1s work, because we often forget that people struggling with obesity, that's the psychological part of it, right? We see the physical signs, we see the symptoms, we see the physical part, but we really don't appreciate what's happening in the brain until people who are on these medications experience this. And that can be so liberating for them.
Absolutely. I never heard about the food noise, but it does really make a sense. You just gave me a sort of different perspective. I totally get people. It's quite traumatic.
Yes.
And you go into these kind of obsessive thoughts, which psychiatrists would understand very clearly, and how to overcome that. I guess we're moving into a bit of a mindset. How can women develop positive relationship with their body, even if it is changing? We are changing.
Oh, this is a good question. Yes, such a good question.
Got into that.
And yeah, mindset work takes time. So I really want people to understand this. You've spent the last probably decades, criticizing yourself, trying to lose weight from a form of as a form of punishment, or trying to lose weight in a way where you treated yourself very punitively. And so it's going to take time to reverse that or to change it. And that's okay. So we need to understand that this is a process. It takes time and we have to be patient. But I think the biggest lesson I've learned since coaching patients is that number one, you must come to this journey from a place of self-love. If you hate yourself, it's far more difficult to be successful, right? Think about like when we're just trying to teach our children lessons, right? There's a certain way that we can get that message across. If we're constantly yelling at our kids and telling them that they're awful and they're doing terrible things and they're lazy and that's going to impact them far worse than saying, look, this is what happened. Let's learn from this. How can we change this behavior? What would make it better? And I think that's super important for people to understand. So wherever you are right now, whatever your body looks like, remember your body, your weight does not reflect who you are, right? It's not a moral compass. And we need to distinguish those two things. So we're going to come at it from a place of self-love. And then there's a lot of mindset work that needs to be done. So we need to explore things like, are we using food as emotional support? Why is that? A lot of times it's because we're just not good at sitting with uncomfortable feelings. And so what we do is we automatically reach for food. Okay, so maybe what we need to do is learn how to sit with feeling uncomfortable, whether that's feeling upset, angry, lonely, stressed, bored. Those feelings can be addressed and managed without food. How do we do that? What strategies and tools do we have? There's lots. The other one for me, a big one, is viewing food and compartmentalizing food as good food and bad foods. So there's good food and bad food. And the reason I don't like that is because if we call a food good, then usually what we're implying is you're good when you eat that food. And if we call a food bad, think of a chocolate bar, then you're bad for eating that food. That's not true. You're not bad because you ate a chocolate bar. The chocolate bar is just a chocolate bar. Food is neutral. And we need to start to change the narrative around food, right? We know that there are foods that help us to acquire our goals. And I like to call them sometimes foods and always foods. So there's foods that we can have all the time. There's foods that we want to have only sometimes, as opposed to good and bad. Take the morality out of food. So that's another big one. I think that can help to change people's mindset and shift that.
Mm-hmm. Amazing. I'm just listening and making some notes, and you reminded me of a couple of stories, and I'm just going to summarize that in a minute. But just to emphasize, trust yourself and love yourself. And don't lose your identity, okay? You already got a diagnosis, chronic condition. So quite often people lose themselves. They start believing that this condition and disease is who they are. That's very wrong back. And know who you are, Mary, John, and Thomas, Peter, right? So you don't lose your identity. Also, there was an example that I would like to share with my audience. A patient of mine, if you're listening to this episode, send my love to you and hi, and I know you're doing well and you do your best. But just an example, a person who's got problems with obesity, right, or overweight, they tend to share their love to the environment. They send me letters, praises, and whatever. They send letters to CAO saying how wonderful service they had. And one day, I met with this person and I said, look, can you send a love letter to yourself? The love you're sharing with
I love that.
with everyone else, just write now to yourself this kind, praising letter. And then this is your journey begins of managing your health, your weight, and everything else in your life. So basically,
Beautiful.
I totally agree with what all you said, and it resonates.
And I bet she probably had, or he, I would bet money on the fact that they probably had a hard time writing that letter, right? Because most people have a hard time being introspective and finding positive things. We're really good at finding the negative things. And that's another reason why, remember that fat loss, weight loss, obesity, it's not just about the loss of fat, right? We need to also remember this journey is about all of the non-scale wins that we get with this. Even if your scale moves this much, if you all of a sudden now are you're able to lift slightly heavier weights. Your mobility has gotten better. You feel more confident. Maybe you have a bit more energy. Those are all wins that are not tied to a scale that deserve as much celebration, right? Those are measures of success. I've had patients tell me even they noticed that their watch, they had to tighten up their watch a little bit more. The scale didn't show any change, but they were like, oh, I get to tighten up my watch another notch. Or I had another client of mine who said she's a teacher and she'd have to walk upstairs. And every time she got to the top of the stairs, she couldn't participate in a conversation with the other people there because she was out of breath. In a matter of 3 months, she was able to get up to the top. No, she didn't have to go to her classroom to catch her breath. She could actually partake in conversation. That is a huge non-scale win. So we have to remember that it's not just about the numbers.
And I totally agree. And I think let's don't get obsessed. But let's give a task to our audience. I just come up with one idea based on what you said. So I would like everyone who's listening and who's like me, likes to document things and write things and summarize, do the tables. And if you're that person, I would like you to do a table. What Doriana just said, you list sometimes on one side, on the left, and then on the right side, you make another column, you say always. And you do that for food that you consume. Okay, so we no longer, as we agreed here, that we no longer divide food into good and bad because it has got a bit of a negative connotation, so we don't want that. But we can say sometimes and always, right? So we do that with the food and nutrition as a mealtime. On the other page on your notebook, you write symptoms. How do you feel right now before you're going to go on this journey of whatever it takes you to be healthy? So we're talking about the dieting and exercising. And if you combine that together and having nutritious, rich food, right? So you then list your symptoms that you have always and sometimes, and redo that again in 3 to 4 months' time, because we know that this is the shit that happens to many people when you're following certain plan. And then you write your symptoms, sometimes, always. And I bet your symptoms that were always going to shift into sometimes. I'm pretty sure. Would you agree, Doriana? Would you?
I 100% agree. I would actually be really excited to see the results of that.
So after this show has been published, send your notes and show us how this shift happened in your life. And you're going to thank us. I'm pretty sure.
Yeah, I love that. I love that. Brilliant.
Yeah. So maybe final words in terms of what steps people should take to implement these kind of changes. Maybe final words of encouragement, navigating weight management, living with chronic condition.
Yeah, so I think that the first thing to remember is that I love what you said about this not being your identity, your chronic condition not being your sole identity. Remember, and maybe you do need to sit down and journal or just jot down, even on your phone, just in your notes, but the things that make you who you are, right? And I know that's one of the activities that I have my clients go through. What makes you unique? What makes you special to other people? Because that's the identity that we need to remind ourselves of. And then the next thing is think about what your long-term goals are. And I like to what I've asked my clients to do lately is to make a vision board. So they can do it on Canva online, or they can do it old school, like pen and paper, but a vision board of the version of yourself that you want to become by 2025, by December 2025. And then what are the things that you can do to get there? And the biggest piece of advice I want to give people is start where you are now and just take small baby steps, right? We do not have to make a 360 change in the next 3 months and change everything about everything in order to see change. All we need to do, as James Clear says in Atomic Habits, it's 1% different or 1% better every day. So maybe today that looks like having an extra serving of vegetables. Maybe today it looks like having a little bit more protein. Maybe it looks like getting a couple thousand steps in or doing some mobility work. So instead of thinking about what do I need to take away? What do I need to take out of my diet? What do I need to take out of the bad habits I'm doing? What can you add? What can you change? And it doesn't have to be something major, because the accumulation of those tiny little changes over time make a big impact. So that would be, I think, my number one recommendation or piece of advice is just to break things down into small steps, make them achievable, make them doable. And if we break them down into small steps, then they become sustainable.
Wonderful. Such a refreshing and inspiring conversation. Thank you so much, Dr. Doriana, for sharing your wisdom, reminding us that health, it isn't about perfection. It's about showing up for yourself in sustainable, kind, loving, empowering ways. And to our listeners, if you're feeling that this episode encouraged you to rethink how you approach your body, your food, fitness, or maybe just rethink again that it's not a journey that you do that on your own. So many people are affected. So many people are on the same journey and they have this noise in their head that reminds about everything, what they've done, good or bad. But maybe, as Doriana said, it's a small change and consistency is important because it really makes a huge difference. So if you want to learn more about Dr. Doriana's work and connect with her for coaching program or her podcast, so Doriana, where people could find you, any website that you could share or any resources?
Yes, absolutely. So I'm on Instagram and LinkedIn at Dr. Doriana. So it's DrDoriana. I also have a website, which is SmplyFitWellness.teachable.com. And the simply has no I. And it can be reached. It's a long story. I can also be reached by email at drdoriana@simplyfitwellness.com. And any of those avenues can be used to reach me. I also have a podcast, the Simply Fit Wellness Podcast, which might be a good resource for people I've got podcast episodes on nutrition, but also I have quite a few on the emotional and the psychological part of not just eating, but just self-care. So that could be another resource for people.
So check out the links in the show notes. And I hope you enjoyed this episode. Please subscribe to Be Well with MS and share it with your friends. Leave a review if it helps to many people. We're going to celebrate and actually having your comments, maybe your notes with sometimes and always would help us to grow, reach more people, and we could be satisfied that actually reach so many hearts and souls today. So thank you for tuning in to Be Well with MS Podcast. Until next time, take care, stay curious, and keep choosing that makes you feel well and your own way. Thank you so much. Thanks, Doriana.
Thanks. Thank you for having me.